humans, how's it going? Susan Ruth here. Thanks for listening to another episode of Hey Human Podcast. It's been a minute. I hope everyone is thriving in 2024 already after a weird holiday season. I really needed that time off. Mental health wise, I think I was exhausted. So it's good to be back after a little break and bring you to episode 389. My guests today are Cherie Rezen and Dr. Amar Raut. They are a nurse and doctor, respectively, and the founders of the Embrace Nepal Foundation. Their mission, quote, to bring hope, health, and happiness to Nepal's rural communities by improving healthcare, education, and overall well-being, unquote. This includes helping to increase high school graduation for Nepalese, reduce child malnutrition, facilitate clean water access, sanitation, provide maternal and child health, specialized health, basic health, mental health, dental health, wellness, sometimes hiking miles into the Himalayas to serve communities that in some cases have never seen a doctor or healthcare practitioner. We're talking grown people who've spent their whole lives and maybe never been to a doctor, or maybe just seen someone passing through somewhere along the way. Really extraordinary couple of people who work with other extraordinary people, and it's such a beautiful cause and foundation, and they leave in February for another trip. They will hike miles and miles and miles and miles up with all this equipment and everything they need to bring medical attention to people who desperately need it. It's really an extraordinary group. Okay, check out heyhumanpodcast.com for links and to learn more about my guests and the show. Check out susanruth.com to learn about me and my other artistic endeavors. Follow Susan Ruthism and Hey Human Podcast on social media. Find my albums, all my music on Spotify, Apple Music, Amazon, wherever you get your music. Rate, review, and subscribe to Hey Human Podcast on iTunes or wherever you get your podcasts. And thank you for listening. Thank you for coming in hot 2024, being a part of this. I hope during the break you took some time to deep dive into some older episodes. I know there's so many on there, but yeah, thank you. Thank you so much for being a part of this. I'm excited for who's coming up soon. Really wonderful people, interesting humans, weird and wonderful across the board. So excited. So yes, thank you. Be well, be kind, be love. And here we go. Cherie Rezen and Dr. Raut, welcome to Hey Human.
Thank you.
It's good to have you back.
Thanks for having us back.
Oh my gosh. We recorded an entire episode, what was that, 2 months ago?
Yes, 2 or 3 months ago, I think.
More than 2 months.
And I was crestfallen when I opened up the program and found that, in fact, it was just... But I replaced my cord, and all is well with the world, and you were both very kind to come back. So welcome.
Thank you.
Thank you so
Welcome.
much.
Let's just jump right in.
Okay.
Say who you are and your background as far as what you all do, and then we'll go backwards a little bit, and then we'll go forwards.
Okay.
We'll do some time traveling.
Okay.
My name is Dr. Amar Raut, and I'm from southeastern part of Asia, land of Mount Everest, Nepal. So I was born and raised there. And talking about my education part, I have my MBBS degree from Kathmandu Medical College, which is in Kathmandu, the capital city of Nepal. After completion of my medical school, I had my 2 years of government service, where I chose to work in rural part of Nepal. It's not required at all, but it depends on you. You can choose to work in the city area, or you can choose to work in the rural part of Nepal. So I chose to work in the rural part of Nepal.
But you don't have, the government doesn't require you to do service.
No, because I got a scholarship. I got a scholarship from Nepal government, in which I was in top 25 student all over Nepal. So I got a scholarship, and for that scholarship, like government wanted me to do 2 years of government service, and it was optional to choose wherever I wanted to go, but I chose to go rural part of Nepal.
Where you were really needed.
Yeah, because I wanted to go and serve the rural community, so that's why I chose that part of Nepal. And I worked there, and then I met Cherie during my second year of that government service, and that's how we got connected, and we had same goal of serving the underserved people. That's how the organization started as well, and I wanted to pursue further educations, so I started preparing for USMLE. So it's United States Medical License exam. So I was studying at the same time I was doing that service as well, and after the 2 years of service, I went. I came here in US. So.
And now you're taking tests to further.
Yeah, I have already completed all my tests, and I have got interviews as well, which is in this January. So I'm preparing for interview as well. I already got that permanent license to work in Nepal as well. But at here, you need to have a specific license to do everything.
General medicine?
Yeah, I applied to general medicines.
Yeah.
So.
Okay. And Cherie?
My name is Cherie Rezen, and I was born in Michigan but raised in Boulder, Colorado. And once after I graduated, I moved to the West Coast, primarily California, but lived in Seattle where I went to nursing school. I've been a nurse for over 23 years now. I love to travel and hike and trek and camp. And on one of my excursions, I went to Nepal to help build a health camp and then do a 10-day trek. And we ended up not building the health clinic, but we ended up painting a children's school instead. And then we did a trek. And I loved it so much that I went back to Nepal several months later and stayed longer. And because I injured my knee, I ended up volunteering as a nurse at the clinic up in the mountains where I met Amar. And I was at that clinic for almost 6 weeks, and I loved it. And we, Amar and I had started talking about, our similar interests in helping people. And of course, I feel like doctors and nurses, that's what they do. They help people. It's in their hearts to do that.
And this was the height of the pandemic that you were doing this, or was this before the pandemic?
It was after the pandemic. Yes. It was like the first trip was really newly after the pandemic, like just maybe a month after restrictions, month or 2 months after restrictions. I guess it was the first trip that was opened to go to Nepal through the agency that I went through.
You'd been going to the rural places and practicing medicine and helping people before that? Or did you establish that clinic that she came to?
So it was already established clinic. So that was under Nepal government. So I went there before the pandemic, before the second wave. So in between first and second wave, I went there. And there, because it was primary healthcare center, so it was resource constrained environment there. But after I went there, so there was only one medical doctor working there. So
for how many people?
So I think for the whole area, so it's like I would say 8,000 or
8,000.
Yeah.
That's a lot of people for one doctor, 2 doctors.
Yeah, but there were many health worker working there, but there are there was a scarcity of doctor.
Were the health workers all volunteers?
They are under Nepal government worker, and I went there, and then the second wave of COVID happened, and all of people had no clue what was going on there. So I started coordinating with the local government, and then I established COVID isolation center, where more than 70 people were admitted and got treated.
70-year-old?
70 plus.
People. Oh, got it. Sorry.
Yeah.
Thought you meant elderly. Yeah, 70 plus people.
Yeah, so in number.
Yeah.
Yeah, so they were admitted also. They were admitted, and we had whatever we had at that time, with a limited resource as well, and with a limited lab and everything. So we tried to manage the case, and they successfully went back to their home. So that was kind of achievement also.
Yeah, it's a big achievement.
So in the daytime, I was looking at my patient in outpatient, and then after that, I had to go to isolation center to see the patients over there. So it was good coordination between me and local government.
Did you get COVID while you were treating other people?
No.
Oh my gosh.
I use lots of precaution.
Yeah, I bet.
But almost 90% of the worker got the COVID, but I didn't got the COVID.
That's good. Yeah.
Yeah.
And so you two met at that facility.
After that.
Then a second after
So initially I was working as a medical doctor only. Then because of that coordination between the local government, it was that helped me to promote as a medical administrative of that primary healthcare center, and they promoted me as a.
Because you kicked ass.
Yeah.
So how in the world do you, with the limited resources, it's not an exceptionally wealthy part of the world.
Yes.
How do you deal with that?
Because I was using so many resources like online, and whenever I got confused at that time, I used to consult with my senior doctor who were working as at a tertiary care center. So that's the place where I got my medical school degree. Mm-hmm. So I used to consult lots of doctor about the finding also, because it was a difficult things for me.
You must have learned so much in that experience, way beyond what you would have had in a traditional school situation.
Yeah, we
call that baptism by fire in the United States.
You grow what you go through, that's people say. So
yeah,
I grow from the experience.
Yeah. And Cherie, when you got there, what was your understanding of what you were to do and what you saw and who you were dealing with as far as the community at large?
When I got there, I really wasn't certain what I was going to be doing except volunteering as a nurse. I didn't know what that would entail, but I sat in the exam room with Amar and did vital signs, and being there immersed in the culture for nearly 6 weeks, I was able to eventually pick up on some of the ailments and what was going on with the patients, and what some of the top ailments were, like blood pressure problems, hypertension, and wounds, because they wear just slide-on shoes when they do farming and hiking, and just slide on flip-flops. The nurses deliver babies there, so there were women that were coming in and having babies, which was amazing to see, because they have their babies and then 6 hours later they go home. They go back to their village, and the babies are all swaddled up and swaddled because we didn't have the radiant heater. But Amar did find one eventually, so babies born thereafter would get to utilize that warmer. And just being there and having like real hands-on nursing, I just fell in love with it, and I wanted to come back and help more, and so I planned on coming back again, and we had decided we were going to do some health camps. We go to a village and we bring the supplies. Like the last health camp we did was arranged with Amar and all his resources and people that he knows, coordinated a health camp that took us 2 days and a 3-hour hike to get there. We took our EKG machine, our ultrasound machine, glucometer, medications, and the Sherpas trekked that stuff on the hike to get that stuff to the clinic for us. And the villagers find out, in this case 15 minutes before, or 15 days before that we were coming. And that particular health camp we had, a doctor came with us, so there were 4 doctors, and there were paramedics that were already up at that village seeing patients, and nurses as well. And there was a lab and a medication room.
What time of year is this happening that you were experiencing this?
July. Yes, that was at the end of July, that last health camp. When we did 2 health camps that month. We did one in another village, and that one was more focused on eyes. So we took eye doctor, optometrist with us, and to screen for cataracts, and so he saw that person saw patients and prescribed the eye drops that they might need, and then they would come over and see Dr. Amar for like a general health checkup, and then he would write down medications and the eye drops.
Yeah, so at that health camp, we found out 18 people who were suffering from cataract. So we try to coordinate that people with the local government.
Because that needs surgery, does it not?
Yeah.
Yeah, they had to get their lens replaced or something?
Yes.
Yeah.
Yep.
Yeah.
So
can't really do that in the just right there on the trail, I suppose. You have to
but it's a minor surgery, so you can do that and go back to your home in the same day. So
what is the average age of the people that you were seeing? Because I remember from the last time we talked, you said that people were coming from miles. They hadn't been to doctors for years, which is extraordinary.
Oh, yeah. Especially in Karnali, there was a good range. Not as many kids, but pregnant women. And I would say like probably 30s to
30 to
80 maybe.
80, I guess.
That's everything. Is there a high infant mortality rate?
Yeah.
I would imagine it would be.
Yeah. So the Karnali camp that we did, they have actually a helipad at that camp in case there's a mother an emergency with a pregnancy, or mother that delivered a baby. They would be airlifted to the local, closer hospital for a higher level of care.
When people are coming in that maybe have not seen a traditional medicine doctor or nurse in so long, if ever, did you find that you learned a lot about natural remedy? Did they impart wisdom upon you as well as you imparting on them?
Yeah, so that's why you have to not just react on the whatever they say, but you have to be more receptive while they say to you something, because like there are lots of superstitious things over there, and they have their own beliefs, and you should not be like, oh, you should not be doing like that, but instead of that, like you should be touching that point but indirectly. So it was quite a learning experience, but because I was already working in the rural part of Nepal, so I knew that the things will go in that way, so you have to be extra cautious for giving them advice as well. So it was learning experience as well, and it was great experience on the whole.
Yeah. Over 700 villagers came, and they were literally trying to break get in the doors. We had security, even though they all had numbers because they were registered and they checked in. Because they had trekked far from their their homes and the surrounding areas, but they were like trying to push through the doors, and it was pretty amazing. And we saw over 700, but we weren't able to see all of them.
What happens to the people you turn away? That's got to be horrible for you, even. I mean, obviously it's bad for them, but that's got to be heartbreaking.
Right. You wish you had at least one more day to get all the rest of the people in.
And they just trek on home and hope for the next time?
For the next time, and there were 2 doctors working there as well. They will come back.
Yeah. Okay.
But just without all the resources that we had. The EKG
they didn't have that kind of
resources. I just picture the Sherpas going up the mountainside with an EKG machine and ultrasound machines, all of that.
And then our luggage, our backpacks that we had, they're pretty amazing.
I imagine too, just because some of these people have not seen this kind of equipment before.
So they have the feeling like that ultrasound machine would detect everything, every pathology, every etiology inside you. So they have that kind of feeling, and they like to come to us and have that checkup as well. So they were not terrified by that, but they were like surprised, and they were overjoyed by the service we were doing at that time.
Yeah.
We did over 140 ultrasounds in 1.5 days, which was a lot. And they all didn't need one, but
were you guys running on pure adrenaline at this point?
It was. I totally enjoyed it. I totally enjoyed it.
And we went back to school for health education also.
Oh, to teach people.
Yeah.
Oh, that's good.
To teach kids about dental hygiene.
Dental hygiene.
How are the STD situations there?
There are, because
it's a situation. I don't know. Is HIV prevalent there, or what is the big gonorrhea?
Not up in the villages, and these remote villages. The girls have babies younger because they get married off, but I don't.
But they have cervical pathology because, like, they are because when you see the girl who has baby, the mother age would be like 16, or even sometimes you can see the mother who has 18, who has like 14 years of age only.
It just hurts my vagina to think about that. Right. So young, your hips haven't even spread open yet.
When that's normal there.
Wow. That happens in the rural part of Nepal. So they have that, but in the city area, like, you don't see anything like that.
Right, it's modernized, and people are The women are maybe more independent in the city.
And cervical carcinoma is very much prevalent in Nepal, basically in the rural part.
From the sun being right there?
No.
Cervical.
Oh, cervical carcinoma. Oh, I'm so sorry. Okay, cervical carcinoma is high. Interesting. Like HPV, you mean?
Yes.
Oh, okay.
And did you... we're planning on doing a health camp where we would bring gynecologists with us, because there's a simple test just that will look for abnormal cells to know if you have abnormal cells, and you would be referred to higher level of care to rule out, carcinoma, cervical carcinoma.
So that's in our checklist.
Yes.
To do.
Yes.
I imagine, yeah. Wow. Yeah. Well, I mean, that's prevalent in America. It's prevalent everywhere, I feel like.
Yes, it's very prevalent there. Very prevalent there. And uterine prolapse is prevalent there.
Yeah, if you're having a baby at 14 and then 16 and then 18 or just
and and they don't have anything to they don't have the gynecologists up there, so that will be one of our health camps as well. Yeah. Interesting. Yeah, and then when we went to the Karnali Health Camp, we did go down to the children's school. What was it, kindergarten through probably 3rd grade?
No,
K through 5?
8.
8? Yeah. And we had 120 some or 130 dental kits that we made and took with us, and did taught the kids about good, proper dental hygiene for good overall general health.
Do they get to eat the thing that colors your teeth and then you brush your
No, we
teeth?
didn't have
I loved
those.
that when I was a
Somebody
kid.
asked the same, and we didn't have those, but we did take floss, toothbrush, and toothpaste. So we will follow up at that health camp when we go back again, and the villagers will know we're coming, and we have to take the same supplies down to the school so that they can keep up with their dental hygiene. And it's all would be by donations because they can't afford that. They don't have those resources to keep up with that. And it's so simple to do to have good general health.
And good, clean, healthy gums is good for the brain. Good
Yes.
for so much part of the system.
Yeah, your internal organs. Yeah.
I don't think people anywhere really realize how connected everything is. The teeth is connected to the brain, and eyeball connected to the brain. That everything is right there in your head, and then your belly connected to your brain, and
Yeah.
everything is a system operating together.
All together,
Yeah.
right.
What made you want to become a doctor and you a nurse?
Because I was grown in the rural part of Nepal as well, so the whole the seed of becoming a doctor came from my grandfather experience, because my grandfather had back stiffness and knee pain, and where I used to go with him for seeking healthcare, and the healthcare provider would give like gels and tablets, and I was completely amazed by like how it works at that time. And I think at that time I started realizing like, okay, there is something like magical tube which works as a magical wand to cure the pain. So that thing was implanted in me unknowingly from my childhood, and I started learning and started doing well in school as well. And later I got a scholarship as well, so I went to medical school, and started learning medicine more and more,
and kicking ass and taking names. And that's great. You came naturally to it once that it seems like.
Yes.
Yeah, that's great.
That was not implanted by someone inside in me, but it grows naturally.
Yeah, that's great. And what about you? What inspired you to become a nurse?
I kind of did it a little backwards. I had my daughter first, and then became a single parent and decided I needed to go to college. And when I was in college, just taking the general classes, I was working at a doctor's office. And so I decided, in this college I was going to had a nursing program, so I decided to go into nursing. And I've always been a natural caregiver, so it was perfect for me. I love being a nurse. I did contract nursing, so I traveled around the United States, filling needs at hospitals, for 13 weeks or 26 weeks. And when my daughter was with me, I would stay a whole year in one location, so she would get that year in school. And I've just always loved being a nurse, taking care of people. And I was gonna, take another job recently here in LA. But then when I went to Nepal and did volunteering, I decided that I'm just going to continue to do volunteering as a nurse. Because that's filling my heart, because you get to take care of people, and just knowing that you're making a difference in somebody's life in that moment is very special and very rewarding. It's like just fills your heart.
I imagine for both of you there are a lot of highs and a lot of lows with what you experience, just dealing with trying to help people and the frustrations along with the triumphs.
Right. Sometimes I say, all I want to do is help somebody. Why is it so difficult? All I want to do is help. But there's always politics involved in just helping people.
Yeah.
So when we started the foundation, we just cut all the middlemen out.
Yeah, let's talk about it. Let's get into it. Where did the seed for the foundation, obviously when you were doing all this work, but how did it germinate, the seed for the idea? Either one
just
of you.
during one of our just during conversation between with when we had time to talk, or we were walking around the village when Amar was showing me around the village, we were just talking, and as I recall, we just talked about like helping, and that I wanted to do the volunteering, and that I wanted to have a nonprofit of some sort, and Amar was like totally the brains behind it. Like he just obviously had the same thoughts and wanted to do the same thing, and it was already building, I think, in his brain, or maybe he could do it just that quickly, but he came up with the business plan and the mission statement. It was almost effortless.
What's the mission statement?
Sustaining health,
Yes,
empowering life, and bridging gaps in Nepal.
I love it.
Healthcare, everybody deserves healthcare. It's not a privilege,
So
it's a right.
we focus main on healthcare, health education, maternal healthcare with childhood nutrition as well. So it's all about like health and educations when you combine, and clean drinking water as well.
Yeah, it's a big one.
Yes.
That's a big one. And the name of the foundation?
Embrace Nepal. You can see the
Embrace
But they
Nepal.
can't see it.
Embrace Nepal Foundation. The
Embrace-
website is embracenepalfoundation.org.
It's a great website.
Yes,
I really
it's exciting.
enjoyed popping around on there.
Oh, have you seen it?
I have. She
Okay.
said
Yes, I did. Yes.
the video is really wonderful. I got
Isn't it the
I got
best?
misty-eyed myself. It was great.
Yeah. It's exciting.
What are the things you need for the foundation as you move forward?
Donations. Donations are great because it's easier to take the donations and get the things that we need there and then take them to the villages versus me bringing several duffel bags of items from here and trekking them there. Also, a little amount goes so far in Nepal. So just having the donations, and we do, I'm taking extra shoes that a friend donated. I've taken jackets. A group I was with previously, they brought jackets, some hiking pants, shoes. We distributed 500 solar lights to the villagers that didn't have electricity because they couldn't afford it. We delivered 500 solar lights to those villagers.
Is it hard getting through the red tape of that, or not so hard? Now that you've done it a bit.
You have to coordinate with the government. The government seems to like to have some acknowledgement that they had some part in it.
Makes sense.
People like acknowledgement. That's
Yeah.
how you can just say to people like, I'm doing these things for you.
Yeah,
So-
that makes
Yeah.
sense. I
Yeah.
understand that. Yeah.
And they're so grateful that we come and do that. The villagers are extremely grateful. They namaste and give a hug. And then the local government and the village, they gave us acknowledgement.
They welcomed us as
Yeah.
well, and they did farewell to us as well.
Yes.
So there was one foundation who was working actively in that area.
Oda.
Foundation, yeah.
Oda Foundation.
So Oda Foundation was also doing great job there, like doing serving people for 10 years over there. So we had to coordinate between government, Oda Foundation, and that's how it went.
Yeah. And the Oda Foundation, they started with one building, and now they have a little village that has the clinic, the medication room, housing for the doctors or whomever comes up there. But in helipad, it grew. And I envisioned, and I said this before we went up there, that I envisioned having a clinic, building a clinic, like a Patch Adams kind of thing.
Sure. I
Building a
interviewed him
clinic.
for the show, by the way.
Oh, you
Oh,
did?
my God.
Oh, wow.
I did.
Yes, and I had Amar watch Patch Adams because it's just such a good show. But I envision that for our foundation, having a health clinic and having volunteers from America come, nursing students or nurses or medical students, just to go there and be part of that culture and see what it's like to take care of people in a different culture and see the disparity.
I'm surprised that isn't a requirement in medical school and or nursing school to have that where you go and have a year of service in another country, just because I think it would enrich the service.
It humbles you.
Yeah, absolutely.
Yeah, it humbles you.
So you already answered my next question, which was, it's not just money you seek, which is extraordinarily helpful, and please donate, but people.
Mm-hmm.
Yeah.
Yes.
It's a will.
Yes.
Like when you have will inside you, you can do whatever you want to do, but all you need is determination.
Yeah.
To get the things going, because I would say one incident which happened one month back in Nepal. So we had earthquake in that Jajarkot of Nepal. So it is also a kind of like a rural most or remote area in Nepal. So we were here.
There were a lot of deaths.
Yeah.
It was very sad.
And we were here, and there was nobody there who can coordinate. But we tried to coordinate between another foundation or with another foundation as well. And we successfully distributed 50 blankets and foods for the needy people at there. So it requires determination and the will to go and will to help the people. So
yeah, I think it's important to remember for all of us as human beings that the tiniest amount is still more than nothing.
Yes.
So if it's one blanket or one coat or $1, it's more than zero about any of those things.
Yes.
Yes.
Yeah.
Yes.
I mean, I long for a world where we see people from no matter where they are as ourselves.
Exactly.
We've got a long road to go on that, but it gives me hope to know that people like you are
there are many people
toward that.
Yeah,
I know there are. It gives me hope, and because I think we can get bogged down with the idea that everyone's just out for themselves. But the truth of the matter is, I think people are inherently they are good.
Yeah,
and they see them. They want to help.
Yeah,
we see that in disasters all the time. Strangers stepping up and doing the thing.
Yeah.
I was thinking about this yesterday. I was walking down here along the cliff, and it was at sunset, and I love it because there's dogs everywhere and it makes me so happy. But I was walking along, and there were so many people collecting from all walks of life, all ages, I'm sure all socioeconomic backgrounds, and everyone had stopped to watch the sunset. And as I was walking, I was looking at the people, I was looking at the sunset, and I thought, oh man, if we could just capture that and remind people that yes, that is exactly who we are. Mm-hmm. We all want to watch a beautiful sunset. We all want to fall in love or have a good meal or be able to breathe or drink clean water. Everybody wants that. And there shouldn't be anyone thinking that one person deserves that more than another. Because at the end of the day, we're all watching the sunset going, wow, that's beautiful.
Exactly. Yeah.
Yep. It's such a cool moment.
Yeah.
What's your favorite thing about Nepal?
I would say the villages and the villagers.
Yeah.
Yes. Yeah. That's my favorite thing.
What about you?
People in city.
Yeah.
Sorry.
It's a city way, way different, I'm sure.
It's I am trying to know, jokes apart, I am trying to know lots of things about America as well, because it's completely different from Nepal. So it's a cultural diversity as well for me, and I'm learning more and more with each day passes by.
Yeah.
So I'm learning and I'm enjoying every bit of staying here. So
are you coming up against any kind of weirdness that you're from Nepal, or that your accent's a little heavier or anything?
But not much. But because like people have hard time in understanding the English because of my accent.
Yeah.
But I'm trying to learn about that accent as well.
Honestly, I can understand you better now than you were 2 months ago, if that gives you any kind of hope.
Oh, yeah.
That's what I told him, that it's so much better than when you first got here.
Immersion is everything.
In the culture.
Yeah.
Immersion's everything. How many languages do you speak?
6.
Fuck. 6? How about you?
1.
You don't speak any Nepalese? Is it Nepalese?
No. I
Nepali,
Nepali, I know words, but since I've been back home, I haven't been using them. So.
When's the next trip over?
February 3rd.
Ooh.
Yes.
Oh my gosh.
Less than a month.
Yes.
Are you ready for it? What happens? Tell me about that. What's going to happen? What's the plan?
To coordinate, try to do at least 4 health camps and do follow-up at
The Karnali.
Karnali Health Camp, the one that was a 2-day and 3-hour hike adventure. And it was an adventure, let me tell you.
Your lungs are probably used to that atmosphere.
No, I'm very lazy for doing that kind of hiking.
Yeah.
It was my first hiking.
That's a whomper. I mean,
yeah.
Between the elevation and just the way lungs work.
Right, yeah. Especially going straight uphill.
And then you see people on top of I always thought this was hilarious when I would go hiking back in Washington State. You go to the tallest mountain, there are people smoking up there. I'm like, what are you doing, you crazy person? How can you do that?
Yes, I was just talking about that today when I was at the frame shop. I was telling somebody when I did the trek that took me over 17,000 feet, there were cigarette butts up at the top of that
amazing
summit.
To me.
But it's obviously the Sherpas.
Yeah, for sure.
They're used to it.
Badass. I don't know how they do that.
They're amazing.
Yeah.
They're amazing.
Definitely. Yeah. So you go in February, and how long will you be gone?
12 to 15 weeks.
That's a good
12 to 15
amount
weeks.
of time.
Yeah. It takes, there's time to coordinate the health camps. And
you have to get the word out, which must take forever.
Yes. And then coordinate with the local government, decide then if we're going to do if we have to get specialty doctors that are specialized in certain areas, we have to coordinate with them and their schedule so that they'll be able to join us, and then transportation. So, and probably it'd be nice if we could do the Karnali Health Camp for 3 days this time. And then another camp, I know they want us to come for at least 2 days.
That is Sinduli.
And that's in a completely different opposite direction of Karnali.
Embrace Nepal Foundation.org. If you're interested in being a part of this, could people maybe join up and come out to this?
Yes.
Yeah. Maybe you've been looking in the new year for something to really inspire you. This seems like a thing to inspire, to be sure. It changed your life, right?
Oh, yes. Totally. Yes. My family even thinks they have noticed a difference, and me finding something that really fills my heart, since I hadn't, been to work as a nurse for probably 2 years prior to that, doing some other things.
Okay, I'm going to ask you a reincarnation question, because I believe in reincarnation. Did you feel that when you got to Nepal that you had been there before? Did it feel like home in any way?
I don't know if it felt like home like that, but I felt at home. I felt it was my second home, and I just felt like I was with my people.
Yeah.
Yeah.
I love that.
Yeah.
It's exciting.
It's awesome.
Yes.
It's exciting.
It's exciting.
I hope you get all the money, all the help, everything goes really well, and all those people get lovely medical care. And I imagine therapy care is a part of it, yes? Is that going to become something in the future?
So
mental health, I should say.
Mental health. So because I have posted this video in LinkedIn account, so many people messaged me, and out of that many people, there was one assistant professor of Pennsylvania. He contacted me. He was a psychiatrist. So he asked me, we shared phone number as well, and he asked me if he can do volunteering work.
Amazing.
For the foundation as well. So we are in contact with that, and he has, since he is working in the university, so he has his own manpower as well, and he would like to connect with us also. So
mental health will
yes.
become an aspect of it. That's great, because I imagine that's a big part of life.
Yeah.
So he is very willing to work with us, and we are also very excited to work with him.
Yeah.
With his team.
That's wonderful.
I feel like everybody wants to help in some way. I was in Tamil, and I went into that store, and there was a gal who either just graduated from pharmacy school or she was a pharmacy tech, but she asked me, how long was I here? What was I doing? And I told her, and I have her phone number because she wants to join a health camp in the pharmacy aspect. So I got her name and phone number.
Great. How can people email if they want to volunteer or want to help somehow? I know that there's the website, so they can definitely go to the website. Is there an easy access email?
There is. There's an email on the website, info@embracenepal.org is the website, and that's is the email, and that's on the website.
Okay, great.
And another
Did I get is the website Embrace Nepal Foundation.org or embracenepal.org?
Both.
Okay, great.
Yes.
I was like, oh no, I got it wrong. Okay,
yes.
Great.
And
Perfect.
we're also going to coordinate trekking adventures as another way to come and help and enjoy your and do some trekking. So we have guides set up. So we're cutting out the middlemen. So a 10-day trek in Nepal will cost you probably $2,000 less to do it through our foundation. And they would just contact us. It would be set up with the guide, and part of their cost would part of that would be donated to the foundation, and then the rest would go directly to the guide and the Sherpa and the tea houses.
Oh,
and
lovely.
no middle people in between
so that's
to
really,
take any of the funds.
Yeah, that's great. That's a way to be of service while also enjoying an interesting experience.
And the trekking is amazing.
Yes. You both are wonderful. Thank you for being on the planet and for making it better.
Thank you
for interviewing us and having us on your podcast. It's so exciting.
Absolutely. Thank you for coming back.
I just see big things happening. I want it to happen like yesterday, but there's time.
Yeah, it's exciting. And this, I'll put this out so that it comes out before y'all go.
It is 501c3 pending right now. The application was sent into the IRS, and so people will get tax deductions for donating.
That's great.
Yeah.
Will the treks be tax deductible since a part of it?
Yeah, because it's going to be through the foundation. Yeah. So say the trek with the donation is $1,500. The whole thing would be deductible because it's done through the foundation, which is the nonprofit.
And to clarify, the treks, you don't have to volunteer medically. It's just a trek.
Correct. Yeah. Yep, just to trek. Another way to help. Come and enjoy a trek. And while you're enjoying that, you're also helping the people in Nepal.
That's great. Thank you both so much for being here.
Thank you again for having us.
Thank you for listening, everybody.
Thank you. Bye.
Bye-bye.
Rate, review, and subscribe to Hey Human Podcast on iTunes or wherever you get your podcasts. Thanks. Bye.